Maybe you clicked because this touched your heart, or you've been following my journey and watched every video, or perhaps it showed up in your recommendations feed. Whatever brought you here, I am so thankful. Willow's journey is a reminder that spotting heart failure early and getting prompt veterinary care can be life-saving, giving guinea pigs more time, comfort, and a better chance at a happy life. In this video, I'll walk you through the experience I had with Willow, clarify what heart failure is, teach you how to spot the symptoms, and the treatments that can help. Let's start from the very beginning. In early April, I first noticed Willow coughing more than usual. We were in the middle of moving, and I was finishing up the wall repair and constant cycle of mudding and sanding. Although all the windows were open and the fan was running to the outside, the dust was still getting around. One day, I even moved my guinea pigs into my mom's room to give them a break from the dust. Over time, Willow's cough worsened. Her breathing became crackly and labored, and that's when I knew she needed to see a vet. Thankfully, my brother was kind enough to take her on May 21st. The vet offered x-rays, but I decided to start with antibiotics since I was pretty sure it was an upper respiratory infection. Willow received a dose of antibiotics, and we went home. On the morning of May 28th, Willow didn't come out for her pellets, which was unusual. I had to leave for school, so I decided to handle it when I got back. But when I returned home that day, she was extremely lethargic and had lost a significant amount of weight. I asked my mom if I could call her, but while I was waiting for her response, I reached out to my friends for advice. My mom told me to call the vet right away, so I did, completely frantic. Thankfully, they said they could see Willow immediately if I left right then. My sister was about 10 minutes away, so I asked her to drive me, and she kindly did. At the vet, they examined Willow's teeth and overall condition and diagnosed her with GI stasis. They gave me critical care, antibiotics, and a probiotic to help her recover. The previous vet never recommended probiotics, and I strongly believe that's why she went into GI stasis. The vet said it was very likely, though it could have been a reaction as well. I called out of work and stayed home with Willow for 2 days straight, syringe feeding her critical care mixed with Child Life vitamin C, appetite restore, and digestive support by Sherwood, along with gas drops and charcoal to reduce bloat, all alongside the antibiotics and probiotics. For all this, I had to manually relieve Willow, which was really painful for me to do. By May 31st, she was eating and drinking on her own. It felt like a birthday miracle. Still, she wasn't gaining much weight, so I continued offering her small amounts of critical care along with Benebac, which is the probiotic. On June 3rd, she weighed 889 grams, but by June 4th, she had reached 1,004 grams. She was even able to enjoy our treat on her gotcha day, June 15th. Finally, by July 1st, she was completely back to normal. Willow had lost over 100 grams, but she had regained it all within 2 months. GI stasis is not easy to overcome, and it can take time for them to return to their usual selves. We moved the weekend of June 7th, and I was so grateful that Willow's GI stasis has been cured. However, she was still showing signs of an upper respiratory infection. Settling in took a very long time, especially since I was commuting over an hour to work for the next 2 weeks. On top of that, my room was still piled high with boxes, and I felt completely overwhelmed. Eventually, I set aside a time to research exotic vets in my area who were experienced with guinea pigs. I found one only 11 minutes away. During my mom's work break, she called the clinic and they happened to have a cancellation that day. Willow got an appointment for 3:30 p.m. When we arrived at the clinic, I explained our situation and told them we wanted to try a different antibiotic to see if that would help Willow. They agreed, and I left with both antibiotics and a probiotic. For the next 2 weeks, I gave her the antibiotic every morning and evening, as it said for every 12 hours, with a probiotic 2 hours later at night. Our follow-up appointment was scheduled for August 8th. Unfortunately, Willow was pretty much the same. The only small improvement was that her breathing at night was less labored and the crackling sounds had faded slightly. By this point, the antibiotics should have worked. So the next step was to do an x-ray to see what was really going on. When the nurse returned, she began explaining the x-ray results. Willow's lungs were visible, but her heart wasn't. It was completely surrounded by fluid. Then the words came out that I wasn't ready to hear. Willow was in heart failure. Tears immediately streamed down my face, and the nurse shared that she had a guinea pig who survived only a few weeks after diagnosis, and another who lived for 2 years. Still, it was a heartbreaking reminder that my time with Willow is now limited even more. From that day forward, Willow would be on a lifelong medication. Now that I have shared our story, I'm going to go into the more educational aspect. What is heart failure? Heart failure is a serious condition where the heart can't pump blood effectively enough to meet the body's needs. It can be due to an underlying heart disease, congestional defect, or damage over time. When the heart isn't working properly, fluid can build up in and around the lungs and around the heart itself, making it harder for the guinea pig to breathe and function normally. Signs of heart failure: labored or rapid breathing, especially at rest, crackling or clicking sounds when breathing, lethargic or reduced activity, loss of appetite and weight loss, enlarged or descend abdomen from fluid buildup, bluish or pale gums and tongue, and cold feet or ears from poor circulation. Heart failure symptoms are very similar to an upper respiratory infection, so that is why I suspected it to be an upper respiratory infection to begin with. I didn't notice her being cold until the last week of her antibiotics. Diagnosis. Diagnosis often involves listening to the heart and lungs, taking x-rays, and sometimes an ultrasound to assess the heart structure and function. Treatment. Treatment usually focuses on managing symptoms and slowing the progression. This might include diuretics to reduce fluid buildup, heart medication, and supportive care such as oxygen therapy during flare-ups. Willow is currently on Enacard, enalapril, and furosemide. Further treatment. To further help your guinea pig, keep the room temperature 2 to 3 degrees more to help maintain warmth, as it's harder for them to keep warm. Offer blankets and other cozy items for them to snuggle up in. A pet-safe microwavable heat mat can also help with heat. Just be careful not to overheat them, as it's very easy to do so. Limiting their movement will also help the heart from pumping too hard, which can exacerbate the condition, leading to more serious complications and making the medication useless. This means to keep them from running around too much and jumping onto various items. Keep hides near food and water at all times. While heart failure in guinea pigs can't be cured, the dedication and proper treatment can greatly improve the comfort and extend their life.